Welcome to part 9 of the ERKReg training series. In this chapter, we will introduce you to the ERKReg subregistries and explain how they complement the ERKReg Core Registry. We will look at which subregistries are currently available, how patients can be included, which data modules are shared between subregistries, and which information is specific to each individual subregistry. The aim is not to repeat how to enroll a patient or enter a visit, as these aspects are covered in previous chapters, but rather to help you understand what additional information needs to be collected when a patient participates in a subregistry. ERKReg currently includes 9 operational subregistries. 8 of these are dedicated to specific rare kidney diseases or disease groups: cystinuria through urosys, Bartter and Gitelman syndromes, distal renal tubular acidosis, pediatric systemic lupus erythematosus nephritis, autosomal dominant tubulointerstitial kidney disease, IgA nephropathy and IgA vasculitis, ANCA-associated vasculitis through Aurora, and C3G and MPGN through ComCure. The last subregistry, ESCAPE-KD, follows a different concept. Rather than focusing on a single disease or disease groups, it is dedicated to pediatric chronic kidney disease as a clinical condition, allowing the collection of additional data on children with CKD across different underlying kidney diseases. Each subregistry has been designed to collect additional information relevant to each specific disease, disease group, or clinical focus. Some data modules are shared across several subregistries, while others have been developed specifically for an individual subregistry. Before entering a patient into a subregistry, please make sure that the appropriate informed consent is available. For most subregistries, participation is covered by the ERKReg informed consent. However, additional consent may be required when biological samples are collected or used as part of the subregistry. This is particularly important for ComCure and ESCAPE-KD that include biobanking. Please, therefore, check with our administration the regulatory and ethical requirements of the specific subregistry before collecting biological samples. Once a patient has been enrolled in ERKReg, participation in a specific subregistry can be selected directly from the patient overview. Simply click on the corresponding subregistry as is displayed in the platform. The system will then make the relevant disease-specific modules available for that patient. Please remember that the subregistry does not replace the ERKReg Core Registry. Instead, it adds further disease-specific information to the data that are already collected in ERKReg. ERKReg also helps you identify patients who may be eligible for participation in a subregistry. In the patient overview, the system indicates potential eligibility based on the patient's diagnosis and available subregistries. This is intended to help centers identify patients who could contribute to one of the subregistries. Eligibility shown by the system should, however, always be considered together with the specific inclusion criteria and participation requirements of the respective subregistry. It is important to understand the relationship between the ERKReg Core Registry and the subregistries. The ERKReg Core provides the common data structure used across all subregistries. It includes general demographic and diagnostic information in basic data, as well as a standard follow-up information collected during visit, such as current treatment, anthropometric measurements, and biochemical parameters. Each subregistry builds on this specific core by adding further disease-specific information. These additional variables may appear within basic data, visit data, the medication section, or in dedicated subregistry-specific modules. Therefore, when a patient participates in a subregistry, the ERKReg Core data should continue to be kept complete and up-to-date together with all additional information required for the specific subregistry. Although each subregistry is disease-specific, many modules are shared by several subregistries. This can broadly be grouped into three areas. The first group covers patient and disease characteristics at the time of diagnosis, such as family history, biochemical and clinical features, genetic diagnosis, comorbidities, biobanking, and histopathological diagnostic. The second group contains disease-specific follow-up information, including quality and performance indicators, biopsy information, clinical features, and immunomarkers. The third group focuses on treatment and outcomes, including extracorporeal therapies, hospitalizations, and adverse events. Importantly, the presence of the same module in two subregistries does not necessarily mean that the questions within the modules are identical. Always refer to the user manual of the individual subregistry for the exact information that needs to be collected. Let's now look briefly at what is specific to each subregistry. ERKReg includes both adult and pediatric patients with cystinuria. In addition to the shared ERKReg modules, ERKReg collects specific information related to stone disease and its management. This includes self-monitoring of urine-specific gravity, color, and pH, diet history, radiological detection of new stones, and information on stone-related procedures and surgeries. When entering medication data, please remember that the medication module is intended for the relevant cystinuria treatment. In particular, only alkalinizing treatments should be recorded in this module. Medication information should generally be collected from the time of inclusion in the ERKReg subregistry. For more detailed questions, including how to deal with historical dates or previous procedures, please consult the ERKReg user manual and FAQ. The Barter and Gittelman subregistry currently focuses on pediatric patients. Specific information includes prenatal and neonatal history, such as prenatal manifestations or interventions, birth weight, and acute renal failure during the neonatal period. Sonographic findings are also particularly relevant for the follow-up of these patients. When completing the subregistry, please pay attention to the renal findings such as nephrocalcinosis as well as the magnesium levels. Medication data should also be reviewed and validated regularly, as treatment information is an important component of the longitudinal follow-up. The DRTA subregistry includes both adult and pediatric patients. Specific information includes the timing of chronic kidney disease diagnosis and detailed renal imaging findings, including renal stones, renal cysts, and medullary nephrocalcinosis. The medication module focuses specifically on alkali treatment. When entering follow-up information, please pay particular attention to urinary calcium and make sure that the correct units are used. The total daily alkali dose should also be documented carefully, as this is an important treatment-related parameter in the subregistry. The pediatric SLE subregistry is designed for pediatric patients with systemic lupus erythematosus nephritis. In addition to the shared modules, it collects specific information such as parental high, parental status, and the SLEDAI score. Please make sure that the medication data are regularly reviewed and validated. Blood parameters and immunological markers should also be completed in the visit data section, as they are important for the longitudinal assessment of disease activity and treatment response. The ADTKD subregistry focuses on adult patients. In addition to the shared modules, it collects specific information on clinically relevant events such as gout, kidney stones, and episodes of acute kidney injury. A dedicated creatinine values section is available to document serum creatinine measurements over time, allowing longitudinal assessment of kidney function and disease progression. Isopathological archive is also planned. When completing the subregistry, please make sure that the medication and hospitalization data are regularly reviewed and validated. In addition, serum creatinine and the relevant blood and urine parameters should be kept complete and up to date in the visit data section. The IgA nephropathy and IgA vasculitis subregistry includes both adult and pediatric patients. In addition to the shared modules, it collects specific information on lifestyle factors such as smoking, as well as relevant surgical procedures, including tonsillectomy. Isopathological archive is also planned. For this subregistry, please pay particular attention to completing proteinuria data, kidney biopsy information, and medication at the time of diagnosis. Additional visits should also be entered whenever clinically relevant treatment changes occur, so that changes in therapy can be accurately captured over time. Finally, please review and validate medication and hospitalization data regularly to ensure that the patient's longitudinal disease course is documented as completely and accurately as possible. Aurora is the ERKReg subregistry for adult and pediatric patients with ANCA-associated vasculitis and renal involvement. A disease-specific component of this subregistry is the assessment of organ involvement at the time of diagnosis. This includes involvement of, for example, the lungs, eyes, skin, heart, gastrointestinal tract, and central nervous system, among others. Please make sure that medication information is validated and kept up to date. Blood parameters and relevant immunological markers should also be completed in the visit data section to support longitudinal assessment of this disease. CompCure includes adult and pediatric patients with C3 glomerulopathy and immune complex membranoproliferative glomerulonephritis. In addition to the shared modules, CompCure includes detailed immunological evaluation at the time of diagnosis and during follow-up. The subregistry also captures medication changes, participation in clinical trials, and will include isopathological image archive, which is currently under development. When completing the subregistry, please make sure that the medication and hospitalization data are regularly reviewed and validated, and that follow-up visit information is kept complete and up to date. The immunological profile is a key component of CompCure. Please complete all relevant parameters, and if a parameter was not tested, indicate this accordingly rather than leaving the information unclear. Please also note that the collection and use of biological samples require additional regulatory and ethical documentation. Support for immunological and genetic screening is available through the CompCure network. For further information, please contact to our email. The SCIP-KD subregistry is dedicated to pediatric patients with chronic kidney disease. Unlike the other ERKReg subregistries, it is not focused on one specific disease or disease group, but on pediatric CKD as a clinical condition across different underlying kidney diseases. One of its specific components is the collection of detailed information on congenital malformations outside the kidney, including cardiac, neurological, ocular, skeletal, gastrointestinal, and other organ involvement. For longitudinal follow-up, it is particularly important to record and validate hospitalizations and to regularly review and validate medication information. The recommended frequency of follow-up visits depends on the CKD stage. Patients with CKD stage 2 should have one visit per year. Those with CKD stage 3 should be followed every 6 months. and those with CKD stage 4 should have visits every 3 months. Participation in SCAPE-KD is limited to SCAPE-KD network-affiliated centers and ERKNet centers. Please also note that the collection and use of biological samples require additional regulatory and ethical documentation. This training provides an overview of the structure and the key points of each subregistry. For more detailed information, including inclusion criteria, individual variables, definitions, and specific data entry instructions, please visit the dedicated webpage of the respective subregistry and consult the corresponding user manual. These resources should be your main reference whenever you are unsure about what information should be entered or how a specific variable should be interpreted. And, of course, if you have any further question or need support, please feel free to contact the ERKReg office at erkreg@erknet.org. ERKReg subregistries continue to evolve through new analysis, collaborations, and data collection activities. Updates from the individual subregistries are regularly shared in the Subregistry ERKReg newsletter. We therefore encourage you to subscribe and stay informed about new developments, data collection updates, publications, meetings, and other subregistry activities. This concludes part 9 of the ERKReg training series. You should now have a clear overview of how the ERKReg subregistries complement the core registry, how eligible patients can be identified, and which additional modules and data require particular attention. In the next chapter, part 10, we will focus on data quality and queries. We will explain how the ERKReg data quality management system works, how queries are generated, and what you need to do when you receive a query for one of your patients. Thank you for watching.